Hi everyone, good afternoon. I'm Dr. Mayank Puskar today again, and today I'm here for the webinar on the topic new engineering assessment and taping technique. Okay, so we'll be discussing about the different types of soft tissues around the knee joint, like what all injury can happen in the knee joint, how it can happen. Okay, so all this we'll be discussing. Then we will discuss how we are going to treat it with the taping. Okay, so taping, I'm not only going to discuss about the kinesia tape, I will be discussing about the rigid tape as well, sports tape and rigid tape as well, and different other types of tape as well. Okay, so what you can do, see, all of you must be having the enough knowledge about the knee joint. Okay, but still I will be just going a brief about the anatomy part. Okay, so you can just go through that. Okay, and then we will be discussing about the taping as well. Okay, just 1 second. Already sees in Dr. Ayush Masuri, are you able to listen to me? Okay, yeah, says yeah. So we'll be discussing about the anatomy and then little bit of biomechanics. Okay, not much deep because the assessment itself is a very vast topic, so I'm not going much deep in assessment also. What I will be doing, I will be just discussing about the different types of knee injury. Okay, what all soft tissue will be involved in the knee injury, then like what all taping technique can be used. Okay, so I will be discussing about that. Okay, so once again, welcome everyone, and thanks for your interest in joining this webinar. Okay, hope this webinar will be helpful for you. Okay, I will try to clear all your doubts. So if any problem regarding any doubts, you can directly just send a chat message so that I will be seeing and I will be replying you. It's better. And please keep your mic on mute. Okay, you can switch off your video. There is no need of video. Whenever there will be need, I will just ask you to switch on your video so you can switch on the video. So no need to just switch on the video every time. Okay, and then at last we'll be having question answer session as well. So if any doubt, any case presentation, anything, if you wanna discuss about any case, you can just discuss it. Okay, and you can ask the question in that, so no problem. Asking question is not a problem. Okay, I will try to clear as much as possible. Okay, so there are some like few people, they have got the network issue and for them little bit difficult to join and what. Okay, so it's okay. This is online, so sometimes happens because of the network. Okay, so nothing to worry. Okay. I hope the PPT is clear. Okay, so what I will do doing today's layout will be like we'll be discussing about the anatomy of the knee joint, then little bit biomechanics, then assessment of the injuries. Okay, not the completely assessment of the knee joint. Okay, I will be just discussing about the assessment of the injuries, then associated clinical conditions, then introduction of the taping, what are different types of taping we are using, which type of tape where to use, that we will be discussing, then mechanism, how does this tape works, then what are the uses of the taping and demonstration of kinesia and sports taping, that we will be discussing. Okay, okay, and one more thing, just 1 second. Okay, so coming to the anatomy of the knee joint, everyone knows it. It's very basic thing. Okay, anatomy. Like we have got one model with the us as well. Okay, so I will just show you the anatomy of the knee joint. Okay, so what you can do, you can just switch off your video and there's no need. Okay, we have got the anatomical model as well of the knee joint. Okay, I will just try to show you. So the knee joint, it is a complex joint made up of femur. Okay, so we have got the medial condyle and lateral condyle. Okay, of the femur. Okay, this is medial, lateral. We have got this patella. Okay, tibia and fibula. Okay, this is the quadriceps tendon. Okay, quadriceps tendon. And see, this actually there is some like time limitations in Zoom sometimes. Okay, so what we will do, if this meeting will get disconnected, immediately we will start the another meeting. So no problem. Okay, what you can see over here, we have got the tibia, sorry, femur, tibia and fibula. Okay, this is the quadriceps tendon. Okay, coming to this one, patellar tendon. Okay, then we have got medial collateral ligament, lateral collateral ligament. We have got the medial lateral meniscus, medial meniscus inside. Okay, then we have got the PCL, and inside that we have got the ACL. Okay, so it will be able, you will be able to see from the front. Okay, so see that one. Okay, in between. Uh, Then this is hinge joint, synovial joint. We have got the joint that is the patellofemoral, the joint between the patella and the femur. Okay? And then we have got the tibiofemoral, tibia and the femur, condyle of the femur and tibia. Okay. So after that, we have got the ligaments, different ligaments in the knee joint, that is ACL, anterior cruciate ligament, PCL, posterior cruciate ligament, medial and collateral ligament. Okay. Then we have got the patellar ligament as well. Then meniscus we have got. Okay. So medial meniscus, lateral meniscus. Okay. So these are the soft tissue structures present in the knee joint. Okay. You can see over here. So this is a video of the knee joint. Okay, just you can see there.
The knee joint is the largest synovial joint in the body, and it's articulations between the femur and the tibia, and also between the patella and the femur. So it's a hinge joint, and the main movements you get at this joint are flexion and extension. So in this position here, which we're looking at the model, this is in the fully extended position, so you get flexion and extension. So flexion is back this way, and extension is up this way. And you also get a little bit of rotation at this joint. So when the joint is flexed, so when the femur is pulled up this way, you get a little bit of medial and lateral rotation. But in full extension, which is what we're looking at here, so in the standing position, the femur medially rotates on the tibia, and the joint is locked into position. And you've got ligaments on either side, collateral ligaments, which tighten to lock this joint into position, so it's stable in this position. And then to unlock the joint, the femur is laterally rotated on the tibia. So first we'll just take a look at the articular surfaces of this joint. So the articular surfaces are covered by hyaline cartilage, and you've got the femoral condyles. I'll just rotate it back. So you've got these two femoral condyles articulating with the tibial condyles of the tibia, so the superior aspect of the tibial condyles. So we've got a medial and a lateral femoral condyle here, and we've got the same for the tibia. So we've got medial and lateral tibial condyles, and the articular surface of the tibial condyle is the superior surface, which I'll show you in a moment. So the two femoral condyles here are separated by this region, which sits between them. This is the intercondylar fossa. So this fossa, this intercondylar fossa, is the area where the anterior and posterior cruciate ligaments have their proximal attachment. So I'll come on to talk about that in a moment. And just above the condyles, you've got epicondyles. So this is the site of proximal attachment for the collateral ligaments, the medial and lateral collateral ligaments, or the tibial and fibular collateral ligaments. So the epicondyles are actually they're not articular. So you've got these epicondyles here where the collateral ligaments attach. And then anteriorly, if I just remove the patella bone, you've got this little sort of groove in the femur where the patella articulates. So we'll just take a look at the tibia as well. So the proximal, look at the proximal tibia. So you've got the tibial condyles which articulate with the femoral condyles. So you've got a medial tibial condyle and a lateral tibial condyle. And I'll just remove the other bone so we can look at the superior aspect of the tibial condyle. So I'm just going to rotate the model. So we're looking at the superior aspect, and you can see that.
Oh, you have seen here like the knee joint. It was just a video presentation for the knee joint. Are you able to listen to me, right? Okay. So movement, the possible movement in the knee joint is we have got the flexion. Okay. So we have got the flexion. Okay. Okay. Then we have got the extension. Okay. Extension. I'm not able to do in this one because this is a fixed model. Okay. So extension. Then we have got adduction and abduction. That is the valgus and varus. Okay, so what you can do, let some amount of valgus and varus, you can do some few movements. Then we have got the medial and lateral rotation. Okay, so these rotations are possible in the knee joint. It is a hinge synovial joint. Okay, so you can see over here, there is this one is one video how of an knee injury. Okay, just 1 second. I will just play this video. You can see like how they beat this knee injury occurs. Okay. So in this video, have you seen that the like the tibia has been rotated medially? If this tibia has been rotated, what will happen? The femur will rotate laterally. Okay, and this, if this one is rotating medially, tibia is rotating medially, this femur will rotate laterally, and this patella will come out. Okay, like this. Okay, so it will be coming like this one. Okay, and after that, if he is bending, so obviously it will be like this one. Okay, proper. Okay, so there was a ligament injury, complete tear of the what you can say medial collateral ligament and medial meniscus ligament as well. Okay, so there was complete tear of that. Okay. The next video you can see there is an injury, knee injury in the cricket. Okay, you can see that. So can you just imagine like which ligament was injured? Okay, they will show you again. Okay, see which ligament can be the TO. Okay. See, just see the